a lot of phone calls are not being answered. Like that's the number one issue I'm seeing in my client office is that, like when I look at their stats, oh my gosh, I don't have anybody right now that's over 50.
So we are here, first session of the learning curve, our first lunch. I mean, I know we do this like, monthly? So it's, I'm really glad we're all getting an opportunity to do this. Lynn, Teresa, Malika, me, we're all here for the learning curve. Very, very first time. We're hoping to give some education and knowledge and fun. And we are going to talk a little bit today about just a bunch of different topics that hopefully will be really helpful to everybody. And we're going to do this in our normal style, which is really just kind of all out there and just doing our thing. So Teresa, we have a really big hot topic that's kind of going around right now. And I know you do a lot of these classes and you have a lot of this people that come in these classes and they're asking all of these questions about text to pay and billing and AR and all of these things. So I know that you kind of have the biggest pulse, I think, of all of us on what's out there in regards to what people are really looking for and what trends are happening. Can you talk a little bit about that? And what
Sure. So there's a huge pain point. Like, people want to be able to collect easily. They want to be able to file easily. They want to do all this stuff. But the biggest pain point is that we are doing stuff that we used to do the same way. So right now our patients are all about convenience and wanting to, I guess, work with us the way that they want to work with us. Meanwhile, we are wanting them to call us with a credit card number, to send in a check, to come in with a credit card, and everybody, they just don't want to do that. So I think we had heard a stat that I think 30 or 40% of people pay their bills after business hours, and we still want them to call during business hours. So I want to be able to file my claims whenever. I want to be able to collect payment whenever. And what I'm hearing from offices are two things. It's hard to make change, and then it's also hard to be consistent with those changes because, as you guys know, we're losing people left and right. So the outsourcing piece is coming in big, so we need to be able to accommodate that. But I'm really nervous that we're not changing fast enough for the industry to keep up with other industries around us. So do you guys know what I mean? Like we have to meet these patients where they are, and I think we're having a hard time with that.
We do. Plus I know in my office, I think we do everything so wonderful. We're just so great because, I manage the place. But truthfully, I pulled my call reports and I was shocked at the number of calls that we missed. And it was literally like, I swear, I'm like 29% of our calls on one given day were just going through to voicemail. And I just pulled call reports and I was like, are you kidding me? And this is my practice, right? And I was like, oh, that's really not good. And I think
that's not good. Former practice administrator of the year.
It was really bad. I was like, oh my gosh, 29%. So of course I go out to my front desk and I'm like, 29% of calls have been missed in the last day. That was only looking at one day. That was one
But
day.
I think it depends on the practice's generation.
Oh,
thank you.
Thank you.
Oh, we appreciate that. So pretty.
And I think it has also to do with the age of the practice too. Like, the younger practices, for me that I work with a lot of pedo ortho, those moms and dads don't have a minute.
Right.
So they want to, text to pay. They want to be able to just handle it when they get home and their kids are in bed. And if you're asking them to give for them to call.
From the soccer field?
Soccer field, that's me. I'm that mom literally on the soccer field paying my bills.
Soccer field.
But do you see what I mean? And as you said, due to lack of staff, a lot of phone calls are not being answered. Like that's the number one issue I'm seeing in my client office is that they're, when I look at their stats, oh my gosh, conversion of calls are 20, 30. I don't have anybody right now that's over 50.
Wow.
And it's because there's not enough manpower. So if you're able to, automate some of this stuff and text the patients to pay their bills or have that option set up properly, that really avoids all those calls coming in. And the calls that are more important that come in for emergencies, those things that they need a conversation, they can come through better than versus those that are coming in.
This is tough because you have offices that want to expand. They want to increase their service mix. They want to do this. They want to do that. They want to give higher salaries. But we're not making the appointments, right? And then, we got to have the right tools.
Right.
But we got to get the money in. And just even accepting payments is a small thing. But the whole, obviously I get the insurance complaints. So we're not getting the claims out. They're getting denials. They're not clean. So that comes in. So I think, if you think high level, it's not just about collections and how much like the daily deposit is. It's over a quarter, over a half a year. How much money do we have to reinvest back into the practice to pay for a new whatever imaging you want to bring in, whatever aligner system you want to bring in, right? I mean, to avoid, Lynn's favorite topic is burnout, and I know some doctors that are like, I can't get this new tool that I want, like a new scanner, because I don't have the cash flow, even if I have to buy it this year and it's a deduction. I literally can't afford it. And the reason I bring out burnout is because these doctors want to do new things and they want to increase their service mix, which makes them more excited. You've got Carl. Carl gets excited when he takes a new class, right? They need to be able to expand and grow, or else they get bored, and then when the doctor gets bored, everybody's like, it's a terrible situation, right?
One question around it. What do you say to the doctor? Like, okay, let's use Carl for instance. You know what I mean? Like he's a little older, and our patient base in perio is older. So sometimes you have those offices where it's like, my patients aren't going to text to pay because they don't do this, that, and the other. So have you had that come up at all ever, where it's like your patient base is maybe like on that older end and they're scared to embrace the technology, and you have sometimes the hesitancy of the owner to say, hey, my patient base is there. So I
think you can both speak to this, having older parents and taking care of them.
Absolutely.
Go ahead.
You mentioned burnout and you mentioned, new technology. All of it, I think, really comes back to planning. Are we preparing our team to be able to handle their role and responsibility, how it relates to the profitability of the practice? Because that's what I find with my clients. They don't know. They just think, oh, well, my job is just to fill the schedule. But we, sitting at this table, know there's so much more to that than filling out the schedule. There's got to be a plan. And I think it's that prep time that our clients don't do as well as they should. When it comes to technology and older, I think a lot of children are helping their parents, and I don't like assumptions to be made. I think new technology can be very exciting. It can be exciting for the doctor, it can be exciting for team members, and it is for patients too, because you think about the world we just got out of with COVID. There are new technologies that were coming out that made our lives easier, but somehow we haven't adopted them as easily in dentistry as other industries, medical, PT, all these other things that we're around with our families. That the assumption, I think, of our patient base is, well, if they do it, then how come you can't do it? But we can do it. We can do it in dentistry.
Well, that's really it. So we both have aging parents, so I'm making all the appointments for both of my parents, right? And if I can't schedule online, I'm having a really hard time, because I can't call during business hours like I want to. I'm either with a client or on the road. So I have to be able to schedule online, and all of our doctors are like that. Going in and checking their bills, going in and checking their medications, it's all online. And if it wasn't that way, I think I would find another provider. And so it's not that.
That's a good point.
And I really do think my dad would be able to navigate this and like this, because he's not unlike me, where I don't necessarily want to talk to anyone on the phone. I know that's a shock for you guys to hear, but I don't want to talk. So,
and all I want to do is talk to everybody all day.
See, you might be all right with that, but I'm like, I have to call. So I think if we do need to make that assumption, like you said, COVID, the technology is there, and the other industries are really leapfrogging us. To get my tires changed, I could make an appointment online. Why can
everything.
I not?
Everything. Nails, everything.
Yeah.
I might think about it at midnight, and I'm like, let me see if they have a chat for me to do this.
Yes.
Because we're so wired to do it that way now that I feel like, I'm sure all of you guys, for your internists, you go in, there's a portal for you to check all your results.
Yes.
And we're like, where's the notification? Let me check it, right?
Yeah.
Where I think dentistry still hasn't got there in the sense of the teams and the doctors being on board with it. The tools are there in the toolbox, they're just not using them. And I think they're just afraid of that change, or as Lynn said, we can't do it. Well, why can't you do it? There needs to be a solution for it instead of just shutting down. And a lot of that probably burnout comes from the fact that they got too much stuff going on, and they need to streamline things and have systems in place, and really with all the outsourcing from the billing for all the stuff that they can do.
Yeah.
I mean, there's so many pieces that I think is just being missed.
You know, it's one thing you guys are mentioning burnout, and I think a lot of people use the phrase stress and burnout in the same sentence, and they're entirely different, because I find that most people are definitely overstressed. I don't know necessarily if they've gone into burnout phase per se, but you think about all of the demands that are on all of the practices. They're having trouble hiring. They're having trouble finding good people. And then once they do, are you ghosting me? Are you actually showing up? You know, all of those things. But it comes back to less team members doing more. But if anything, that gives us a chance to innovate and to be able to do new things, take advantage of technology, take advantage of being able to have good team members and do everything we need to do in the order that we need to do it, which goes back to the planning. We need, if our clinical people, which they're wonderful, I believe dentistry, they're oral physicians. And if they plan their clinical perfectly, take that planning that they already do it on the business side, the non-clinical. If they paid attention to the non-clinical as much as they did the clinical, oh my gosh, our questions would be totally different when we meet.
Yeah.
Man, how hard is it now to be an office manager versus when we were, well, I know you're still in it. You're still in the thick of it.
I'm like,
but
what do you mean, yesterday?
I know, right? I have to go way back.
Okay.
She's I'm talking about a lot of time.
You know, I snort. I'm trying not to snort, okay?
When it was like, I'm 5 minutes late because I have to make my team meeting, my huddle.
That's what I'm talking about now, though. Like, what if, like, when we were back in the day, if we missed a team meeting, it was because we were stuck in traffic, right? But now, if I'm driving in traffic, you feel like you have to be at the team meeting in the car.
Yeah.
There's a lot more pressure. I was just talking about this on my podcast yesterday. When I needed to call in sick, it was it was an hour. I'd wake up 4 o'clock in the morning and then spend an hour going through the whole day. What if I'm not there? What if I'm not there? What if I'm not there? And then you get guilt and you end up going in anyways because you're like, oh, I can't do that to my team. Like, that, talk about stress, right? And now add in the fact that we are not as staffed as we need to be. So, you have to, because it's not like your husband, you can't lie to your husband. Like, you can't just take a day off.
Sorry.
Right? I'm not feeling it today. Yeah. But there's a lot of stressors today for a manager that I never really had to deal with. And a lot of it is because of there's too much variety. Like I have too many portals to log into. I have too many employee time cards I need to keep track of. Like, it's just, I want it simple. And I feel like we're making things more difficult rather than simplifying. And that's a big problem I see out there.
So next time we sit down together, we definitely need to talk about the staffing issues. It sounds like staffing is a big thing. I mean, I think that's everywhere, but